There's a lot of alphabet soup here, but there's a lot of different, there's several different models of these devices depending on the man's problem. Some are able to expand in several directions. Some have limited expansion, and the surgeon has to decide what's most appropriate for you. And again, this is not really a beginner topic, but a urologist who's comfortable with penile implantation will understand, based on your history, if one of these modifications is necessary, and that can be discussed prior. So here's the picture I wanted to show you. So on this side of the screen is flaccid, soft. This side is hard. Notice the penis is pointing towards the ground, and now it's pointing forwards. So what happens, again, the man, when he decides, hey, it's time, he goes to the pump. He presses a component of the pump that he can feel, and it's a chamber that transfers fluid from the reservoir through all the tubing into the cylinders. The cylinders fill higher and harder with every pump. So you go from flaccid to rigid, and it stays rigid until the pump is deactivated. So that could be 2 minutes, or that could be an hour. We don't like it if it stays up for hours and hours. There's an issue called erosion. I'll get into that later. But so the man doesn't, if longevity of the erection was an issue, this is curative, because you're hard until you say not. Again, this takes just a few seconds really to get this. Once you learn, this takes a few seconds to get it activated. So to conclude, treatment of erectile dysfunction, important issue, because pills, which are the most common and most appropriate first treatment, they're going to fail. They're going to fail a third of the time. Other options may or may not be acceptable to the couple. And rather than to give up the game, there is a technique, penile prosthesis, which can keep the couple being active together. It's satisfying if patients are chosen correctly by the surgeon, and the surgeon presents the reality of the procedure accurately to both the partner and the patient. That's really the implant part. Now, that device that I just showed you is essentially unchanged since I was a resident. I mean, there's bells and whistles, the antibiotic, reliability, all those things have improved. The antibiotic coating's new. So there are definitely changes, but substantially unchanged since the late 1970s.